In the past few years, a number of companies have marketed wearable devices and mobile apps that can track our personal health data. These mHealth devices and apps have led to the birth of what is known as the quantified self, a phenomenon where individuals start tracking their health markers. A key question of interest in this ecosystem remained unanswered up until recently. Is there any scientific evidence that consumer adoption and usage of these wearable devices and mobile health apps actually leads to a tangible change in their behavior, which in turn can show up in concrete healthcare outcomes? In partnership with a major mHealth app platform in Asia, we designed and implemented a large-scale randomized field experiment based on detailed patient lifestyle activities and blood glucose values from chronic diabetes patients over a 15-month time frame. The randomization involved some patients having access to the mHealth app, some having access to web-based versions of the app, and the rest, the control group, not having access to any of these apps or devices. The adoption of the mHealth app led to an improvement in both short-term metrics and longer-term metrics. Patients who adopted the mHealth app undertook higher levels of exercise, consumed healthier food with lower calories, walked more steps, and slept longer on a daily basis. Some other interesting discoveries concern the outcomes of patients in the group that used the mHealth app, received personalized reminders via text messages, versus those of patients who received generic reminders. Generic messages with generalized guidance about diabetes were 18% more effective than personalized messages at reducing glucose levels over time. Post-experiment surveys revealed that some patients found the accuracy of the personalized messages to be intrusive and annoying, and some said they made them feel constantly coerced to follow the wellness recommendations, which demotivated them and led to a lower level of wellness activities. Overall, our study shows that users of mHealth devices and apps can become more autonomous and more motivated in self-regulating their health behavior, and more engaged and consistent in their lifestyle and wellness behavior, which leads to improved health outcomes.